Hi everybody. I wanted to update you on my latest muga scan, which is a scan that looks at the ejection fraction for the heart, because the herceptin for my HER2 positive cancer, the medication they give me can damage the heart and lead to heart failure. So initially, I guess it was 6 months ago or whatever it was. The first one I had earlier this year, I think it was 6 months ago. My percent of ventricle ejection fraction was 57%, and this time it was 52, which is still below the threshold of 50, but it's within the possibility of being slightly lower, which is not unheard of, but not a good thing. So hopefully it doesn't continue to go down, because if it goes below 50, they may pause my treatment until the heart rebounds. I guess it's a reversible effect of the medication as long as it's caught early. As far as symptoms go, of having decreased blood flow, I guess you would call it. My blood pressure is fine. My oxygen levels are okay. Most of the time they're in the 99 most of the time, which is absolutely fantastic. I've noticed the last couple of weeks, it's when I sit and rest, I notice that my respiration kind of decreases a lot, and I start feeling really, really sleepy. I'm like any time of day I sit down for too long, I literally almost fall asleep, like a narcolepsy type of situation. But as long as I keep moving, I'm fine. I feel great. So I'm helping my muscles, and when you walk and exercise, your muscles are helping your blood flow. So I guess that would make sense that while I'm exercising, I feel good. But when I sit down, I get extremely sleepy, and I guess this is a side effect of the herceptin. So some other odd things I noticed would be like an intermittent weakness in a limb. Like, say my leg will feel tired all of a sudden, but it'll only be briefly. Or an arm will feel tired suddenly, but it'll go away. So it's one of those kind of weird things. I'm like, I better keep an eye on that. I'm pretty sure that the diarrhea, I'm sure, is not helping anything. In fact, which would be really nice to be hopeful of, is that the diarrhea is the cause of the reduced heart ejection fraction, EF, ejection fraction, yes, EF. We're going to call it EF so I don't have to keep stuttering. So I'm hoping that once I can get the diarrhea under control, which I'm trying to do with the Lomotil that the doctor prescribed, hopefully, I'll start feeling more normal. I'm pretty normal for everything considered. I feel pretty good, although right now my voice is feeling really tired. That's why it's kind of hoarse, but it is a little bit later in the evening. It's almost 9 o'clock, which is a little past my bedtime. But when you get up at 5:15, I suppose that's okay, right? So I get up because the animals want to be fed at 6:30, and I'm like, I need my coffee before I go out and feed the critters. So, but anyway, so I thought that was interesting. So the heart, the EF for the left ventricle, it's a common, well, I don't know how common, but it's a known monitored side effect of the herceptin or Congenti biosimilar. And so they have to keep an eye on that. Now, I'm not exactly sure of the mechanism of why that happens. That'd be interesting to find that out. But I thought I'd share those results with you. But everything else looks pretty good. All of the blood work's coming back normally, so that's a happy thing. But just want to let you know. If you think anybody else would benefit from this information, please do share it. I am not shy about my information. I make these videos for you and anybody else who might be going through this with breast cancer or any other kind of cancer that, maybe they need to hear somebody else's story so they can kind of say, okay, I've experienced that and we can get through this. But anyway, so as I learn more, I will share it with you. And as always, find your happiness, share your happiness, and make every day count. Bye, guys.